Welcome to the Research Works podcast. My name is Dr. Dana Poole and I get the privilege of bringing to you a very special series this week. I am here in Slovenia at the European Academy of Childhood Disability, interviewing the researchers and presenters about their work. This is very exciting and I can't wait for you to delve into this whole research conference series. We hope you enjoy the series. Hello, everyone. Welcome back once again, Research Works podcast, EACD Slovenia 2023. I can't begin to tell you how amazing it's been to talk to so many presenters and researchers here. It has been so wonderful, and I hope you've been enjoying the series. And today, I'm going to be talking to someone who I actually just met yesterday. It was in my presentation, and you were the chair of the presentation and told me all about Spain and the work that you've been doing. So I'm so glad you said yes to coming on. So thank you, Dr. Carmen Lillo. Did I say that right?
Thank you.
You've been very polite. Hopefully I've said it somewhat right. And you wrote out where you're from in English for me. It's from the Spanish Society of Pediatric Physiotherapy. But it's actually called something else in Spanish, which you say better, the Miguel.
The University Miguel Hernandez.
See,
yes,
says it so beautifully. It's amazing. And yesterday when we spoke, we really connected on the fact that we're both physiotherapists in the pediatric area and really passionate about evidence-based interventions and therapies. And that's sort of where we got talking. I know today you just came from a presentation that was a combined effort from a lot of leading researchers and clinicians on early intervention in neurodevelopmental disabilities in Europe, sharing experiences, and you had a very specific segment that you presented in, didn't you? What was it that you presented today?
Okay, so I presented a cross-sectional study about a survey that we did in Spain last year.
Yeah.
And the whole survey was about what practices are done by the pediatric physiotherapists.
Yeah.
But today I presented only the part of the early intervention pediatric physiotherapists.
Great. So this was a cross-sectional study. So you sent out surveys to pediatric physiotherapists mainly in Spain. Was that the main area?
Yes. In Spain, we have the CEFIP, that is the Spanish Society of Pediatric Physiotherapy.
I see, yep.
And it has 20 years now.
Wow.
And we wanted to know what are we doing, because our goals are to implement the evidence into the practical training.
Yes.
So we wanted to do to take a picture of the moment because we have done a lot of work to disseminate the evidence, but we didn't know what are people doing.
Sure.
So that's the goal of the survey. So the CEFIP, this organization, was who sent the survey to all the people that are
wonderful,
that are in the association, and also other associations in Spain help us to disseminate the survey.
Great. So it feels like it was quite representative of the pediatric physiotherapy population.
Yes. All the pediatric physiotherapists, or most of them, are inside this society.
Amazing. That's wonderful. Okay, so what did, I guess maybe before we go to the results, even though I'm very keen to talk about the results, what were some of the questions that you had in this survey? Just a bit of a sample of what you asked.
So we mainly asked about the first, of course, the socio-demographics and the job characteristics of the respondents. And we also asked about the approaches that people follow.
Right, okay.
But we didn't ask directly. We asked which activities you do. I work directly with the child. I work with the families. I talk to the families. I give recommendations. I don't work with the child. I only work with the family. So these were some of the answers. And then with these answers, we got a profile of what approach are they following. And then we also ask questions regarding the interventions and the techniques that they use.
Okay, that's very interesting.
It was the main question. The survey was longer.
Okay.
But we still have
That's
no...
okay. Bit of a snapshot.
I only talk about that.
That's fine. From a snapshot perspective. So what were some of your results? What did you find through this survey of pediatric physiotherapists in Spain?
So we found that half of the pediatric physiotherapists working in early intervention use the expert model. So they work with the child and they don't work quite a lot with the parents.
Okay.
And 17% they work only with the family center approach.
Okay.
And the rest of them, I think it's 32%, they are in between. They are in transition between an expert model and the family center.
Wow. Okay. Was that result surprising to you? Or was it what you felt like you expected?
I thought that before the survey, I thought that the results were going to be higher in the family center because now there are many people doing trainings and learning about that.
Yeah.
But maybe those people that do the trainings, maybe they still don't follow all the recommendations, or maybe there are many people that still don't learn everything, or I don't know. We have to...
Yeah, it's so interesting, isn't it? And sometimes it seems surprising because when we come to places like this, we talk about it endlessly, about involving the family and a family-centered approach. But it's also important to know that hasn't changed in actual practice yet, and we need to do a little bit more. I think that's important, isn't it? What about intervention approaches? What did you find in terms of what was the finding for that?
So the interventions, we are surprised, but it's a good surprise because we found that more than 60% of the techniques that people are using are evidence-based.
Wonderful.
Yes.
That's great. That's really good to know.
Yeah. And for example, the most physiotherapists use support products and interventions on the caregivers and task-oriented approaches and that. And so, active techniques.
Fabulous. Yeah.
So it was
That's
a great
news. That's really good news. Interesting though, like even though that percentage is really high, like at more than half of 60%, 40% is still quite a high number of... Not necessarily. Was it 40% that was non-evidence, less evidence-based,
No.
How did that separate?
No, there are techniques that are used for by few people, but they are still evidence-based.
Yes.
For example, hydrotherapy.
Yeah, okay.
That has good evidence.
Okay.
I guess that because you need a swimming pool or something.
Sure.
But so it's used only by 20% of people.
I see. That's great. Yep.
Because maybe they don't have the environment for doing that.
Yep.
And other techniques, for example, virtual reality. That is not very expensive in some ways. Is used only by 20%.
I see. Okay.
So maybe we need more training or knowing better the games or something. But there are other techniques that are very used, but have no evidence. For example, the stretching, the passive stretching, and those techniques are very used.
Right. What other interventions were listed there that don't have a lot of evidence behind it? Was there anything that stood out to you?
Okay, there are. We use mainly the paper of Novak of 2020 to just to classify the evidence of the techniques.
Okay, great. Yep.
So maybe there are techniques that nowadays have a little bit more evidence than 2 years ago.
Yep.
And for example, there is BOAT, BOITA, osteopathy. Those techniques are still very used, and they still don't have enough evidence. So we have to learn, or maybe they should do more research.
I mean, it's really interesting in that space. I remember talking to, I know that's been listed in the traffic light system now, and not so long ago we spoke to Anna Tavelde from the Cerebral Palsy Alliance and her team there of Kathy Morgan and Arno Novak too, and they found that with NDT and their meta-analysis that there was actually a lot of studies that have been done on it. It was quite a big sample now, and it still wasn't something that was seen as evidence-based, and they called for the de-implementation of NDT, and I know there's different forms of NDT as well, so it makes it quite complicated in that way, but it's interesting to note that these techniques are still around because it reflects maybe when you were trained and when you practiced and opportunities to do more training. Are there other things that we can do to support more evidence-based practice? Is there anything else we can do?
I think we can do things like this.
Yeah, sure. Yep.
So to disseminate science, because I think it's very easy for people that are working at the universities or in the scientific societies or that are doing research. All these people have very clear what to do, but there are lots of people that maybe they don't have access to the research, or for example in my country many people don't speak English or don't read English, and it's a barrier, of course. Sure. Or they don't know, many people they don't know how to look for the papers or where to look for the evidence, so they can. So I think we need more training in how to look for the evidence, of course, physiotherapists need training about everything all our life. Yeah, but
keeps going.
Yes, but in this aspect, I think the universities are doing a great job. Yeah, but still need more work to do because there are still people that need help.
That need that support. For that. Yeah, sure. Yeah. Well, as a final point, that was great that you covered so much there for us. Is there one main take-home from your study that you would like therapists to really remember and take away from this conversation? Is there anything that you can think of?
I think that if we compare what are we doing now, for example, the people who work many years ago, and we compare what we did 20 years ago, we have learned, we have evolved. Yeah, so I think we are on the way. Yeah. But we have to keep learning. We have to keep doing research, and I think that the people that are working in pediatric physiotherapy should be open to the new approaches and to learn and don't be afraid to stop doing things that we have learned many years ago. Maybe they are a step, and now we have to do more steps and learn more, and that's my view.
That's a great perspective. It's a great perspective. I think sometimes letting go of things that you might have spent a lot of time doing in the past can be really difficult. But you do need to also remember and challenge yourself that we are health professionals, and you need to keep up and keep moving forward and embrace what the evidence is saying. So, that's great information from that study. Thank you so much for sharing that. Again, I'm going to say it one more time. The fact that you speak to me in English, I can't speak Spanish. And so I know sometimes my questions when I say it in English is a little bit tricky. So thank you for still answering. I think it's absolutely incredible. And I can't begin to describe to people how impressed I am when people who don't naturally speak, or, their mother tongue is in English, and then you have to translate in your head to speak to me. So thank you for your patience with me and being able to talk to us in English.
Okay, thank you so much, and thank you for understanding. And if I made mistakes, I'm so sorry. No. I tried to do my best.
You were amazing, and I can always learn from this too. So thank you very much for sharing all this information. I think it's important that we all know what everyone's doing from all around the world. So to all of our listeners, thank you once again for tuning into this episode. I hope you you're enjoying it. I'm sure you'll have so much more to listen to, so take your time going through all of the content that we have for you. But I'll talk to you all again really soon. Bye.